Hey guys, so through your time with Gordon Cooper, you're going to hear this nifty term, spelling words. And during this, one of the biggest ones is 5-3 ABC Go. This one's going to carry you through your entire time through EMR, EMT, paramedic, however far you choose to go. But your time at Gordon Cooper, you will need to know this 5-3 ABC Go. The 5, we're going to break it down. So the 5 is 5 things that you need to remember when you are going on scene of a call or doing any kind of patient care. This is just a way to break it down to kind of remember what we need to be doing. So 5, your first one is going to be PPE. This is gloves, masks, gowns, goggles, whatever personal protective equipment, PPE, you need to have on to protect you from what's going to come at you. Blood, wind, somebody vomiting, you don't want it on you. So PPE, what we need to do there. The next one of this 5 is going to be your scene safety. So scene safety not only is making sure that you don't have somebody coming at you with weapons or that there's not a flaming tomahawk flying around in the air. This is also going to be making sure that there's no large holes in the yard if you're at someone's house, making sure that the rugs are picked up so you don't trip and fall on your face trying to tell someone that you're there to help them with a bloody nose. Making sure there's no dogs that are rolling around that are going to attack your ankles, because that's not fun. So scene safety, and this is one thing that you need to be doing constantly. Scene safety is vital for you, your partner, the patient, everybody that you have on scene to make sure that you guys stay safe. The next one's going to be your MOI or your NOI. So your MOI, M, mechanism, trauma. Mechanism of injury. This is what happened. Why are we there? Is it a wreck? Is it an assault? Did you get hit in the face with a basketball? But what is the mechanism of injury? Why are we here? Or your NOI, which is going to be nature of illness. Chest pain, shortness of breath, abdominal pain. This is what a nature is, the nature of illness. The next one is going to be additional resources. At an EMR level, we're going to have additional resources. So when you are going on a call, you need to already have in mind what resources you need and how you're going to get them there. Because this is going to be something we have to have. They have to be able to go to the hospital, additional resources. And the last one is going to be C-spine. Yes, C-spine is for trauma patients, but if you have a medical patient that has a seizure and they fell, you're going to have to look at C-spine, make sure that we don't have any C-spine complications there. Then, from here, you'll move over to your 3. So this is your 5. 5 things that you need to keep in mind as you're going to scene and when you first get on scene. 5 things you will be tested over, the initial 5 right here. The next one is going to be your 3. This one of the 3, the first one is AVPU. So AVPU is going to be your level of alertness. This is if you walk into someone's house and you see them, are they alert? Are they talking to you? Are they responding to you in an appropriate manner? Meaning, are they looking at you and able to hold a conversation? If so, they are alert, and we don't need to move down because you can only be one of these. If they are not alert to that, then we'll move down. Are they alert to verbal stimuli? This is making sure that you're raising your voice, especially if we're Mima or Papa, making sure that they'll be able to hear us with all of the hearing problems that they have from their rock and roll in their young ages. Or even if they're our age, just make sure that you're speaking in a loud enough tone that they'll be able to hear you. If they appear unresponsive, not talking, not listening, and you speak loud enough and they respond to you, that is alert to verbal stimuli. Now, if they are not alert to verbal stimuli, we cross that one off and we move to the next one, and that's P, which is painful stimuli. So they're not talking to you, they're not listening when I holler. So then we'll pinch their earlobes or we'll pinch the skin by the clavicle, and this is going to be painful stimuli. If they respond to you with that, if they cry out in pain, if they are able to have some sort of response to a painful stimuli, then that is where we are, at a P on the AVPU scale. If none of these things are present, they are unresponsive. So you can only be one. Alert to verbal, alert to painful, or unresponsive. figure out which one they are, and we move on to the next thing, which is your chief complaints or your life threats. So if they're unresponsive, you might not know exactly what their chief complaint is. They're not going to be able to tell you. If they are found unresponsive in their house, you don't know why. So what are our obvious life threats? If they have a pulse, if they're breathing, but they've got massive bleeding from their leg, then we can assume something happened. We need to stop that bleeding because that is a life threat. Or their chief complaint, chest pain. Which one is it? Or do we have any obvious life threats that we need to be controlling in that moment, and what is their chief complaint? And the next one's going to be number of patients. This one is important because for our additional resources, if we have 42 patients on a scene, if we have a mass casualty, then we need to be able to relay that information to get more resources there that we're going to need to help these people. So knowing how many patients you have, keeping that in mind on a medical call as well, because you can have more than one if it's a medical call. But how many patients you have there that you need to be paying attention to. And then the next one is ABC. So ABC is airway. Is their airway open? Are they breathing? Are they talking? Is there anything in their mouth? Do you see any dirt, vomit, blood? Is there small toys that they shouldn't have had a hold of and got in their mouth somehow? Grass, any kind of thing. Is there anything blocking their airway, preventing them from having a patent airway? If so, let's handle that, suction them if we need to, and if not, we'll move to breathing, which is your B. Do we have equal chest rise and fall? Do we have adequate respirations? Do we need to put on oxygen? Supplemental oxygen via nasal cannula, non-rebreather, BVM. Do we need to help them with their breathing? The last one's going to be C, which is circulation. This is, do they have a pulse? If they're alert talking to you, feel for a pulse at the radial because you know it's there, but figure out what it is. Is it strong? Is it weak? If they don't, we feel for the carotid pulses, and then is it strong? Is it weak? How does their skin feel? Is it cold, warm? Are they pouring sweat? Are they dry? Are there any kinds of bluing to the fingers or the lips, discoloration that we need to be concerned about with poor circulation? And then the last part is the go, and that is transport. Do we need to transport this patient? Do we need to transport them emergently, non-emergently? How do we need to go about making sure that this patient gets where they need to go? This is your 5-3 ABC go.